Okay. Hi, everyone. I'm Dr. Sheila Nambiar. I'm an OBGYN and a lifestyle medicine physician. And today I have with me Anjali, Dr. Anjali Nakra, who is a family physician. And her passion is to help people to manage their illness or even prevent illness, helping people manage through nutrition, stress, physical activity, sleep, and other factors that impact their health. She is the founder of Path to Health, a clinic that Path to Health clinic, and the secretary of the Indian Society of Lifestyle Medicine. Welcome, Anjali. So glad you could be here this evening. So today we're going to just chat about lifestyle medicine. As I was telling Anjali, the main objective of today's talk is to get people interested and also get people to understand a little about lifestyle medicine and understand how they can use lifestyle medicine and lifestyle medicine physicians to their benefit. So just to start off, Anjali, if you could explain what exactly is lifestyle medicine.
Yeah. First of all, Sheila, thank you for inviting me.
My pleasure.
I'm always happy to talk about lifestyle medicine. And yeah, so lifestyle medicine is basically using the lifestyle pillars like the nutrition, exercise, sleep, stress, substance abuse, all of these, um, and even social connections for treatment, prevention, and reversing diseases, the lifestyle diseases or the non-communicable diseases that we are facing these days.
And what got you interested in lifestyle medicine, Anjali? You were just telling me you started off with ophthalmology,
Yeah.
and
No, my interest actually, I won't, say I was interested at that age, but yes, it set me thinking. I lost my father when I was 18 years old. And I would always wonder why, I mean, we were a normal, uh, you know, vegetarian household, no partying all the time, no eating out all the time. And still, this happened. And so I would always wonder what could have been done to prevent this. And then of course my teacher was my mom. She became a diabetic, and she was, I think, for more than a decade she was on oral antihypoglycemics, and then and eventually had pancreatitis, and she was told, okay, now you be super careful about your what you eat. And in spite of the fact that she was not one of those who had very, she would eat normal food and everything, but she was so careful about her diet. She lost weight. One by one, all the medications came off. And her blood sugar after a couple of years never went, her fasting never crossed 100. It was amazing without medication. So
she did this
that
by
was,
herself. She did
sorry?
it. She did this by herself
By
without any
herself,
guidance.
by herself. I mean, she would just occasionally ask me, okay, is this okay for me? Is this not okay for me? And that's it. I mean, it was not even as if I was formally guiding her.
Mhm.
And that was my first lesson on reversal of diabetes. And
Mhm.
and in any case, I was always on the lookout for more and more information. And anywhere I could just read something about what we could do with lifestyle, I would just go about,
Use
just
that.
yeah, yeah.
Yeah, yeah.
So even
And
before,
yeah. So how did it? Can you just tell the audience and the viewers how and where it started, where lifestyle medicine started, and how it kind of evolved to various parts of the world?
I think lifestyle medicine, I think the American College of Lifestyle Medicine was formed in, I think, 2004, if I'm not mistaken.
4 or 5.
Four or
Yeah.
five, something like that. And I think they started very small with very few people, and then it took time to engage more people, to make more people interested in it. But I think there is so much to lifestyle medicine and lifestyle, how what lifestyle modification can do for you, that eventually it has picked up. Today I think they have 700 board certified lifestyle medicine physicians in the US alone. And of course, other countries, I mean, Europe, UK has a lot of lifestyle medicine physicians, Australia, Philippines, I mean, some of the Asian countries, Latin America. Many of the countries now have very strong, presence of lifestyle medicine. And I hope India is going to be soon joining the list.
Yes, with the Indian Society of Lifestyle Medicine, for sure, for sure. So
Yeah,
yeah, and I think what needs to be stressed here is that the reason why lifestyle medicine has become very, one of the most important aspects of allopathic medicine, the field of allopathic medicine. So one of
yeah,
the reasons is because it became very evident that while we say that heart disease kills patients, or hypertension kills patients, or diabetes kills patients, diabetes, heart disease, and hypertension are only the symptoms. And that is what we are treating as physicians, which is what we've been taught to treat. In medical college, we've learned all about the pharmacotherapy and how to bring down the blood sugars, manage their side effects, and all of that. But the real cause of death, or the real cause of morbidity, is something else. And the research has actually shown that it's primarily three things, as you know, which is diet, not enough exercise, not enough activity, and earlier it was tobacco. Of course, tobacco consumption,
yes, that thankfully.
utilization, that's come down. So primarily it is diet, exercise, and of course stress adds to the whole thing. So when these three are the primary reasons for the other diseases, for the various disease, chronic or non-communicable diseases, how can we just treat symptoms? Right? I mean, obviously, when the patient comes to you with the symptom, you have to control the symptom. You have to manage the blood sugar. You have to manage the blood pressure, or whatever problem he has. But unless you get to the root cause, we are just actually putting band-aid on the problem. And there's this very beautiful picture of a tap that's leaking. You must have seen this. It's all over the, it's in all over the lifestyle medicine organizations. There's a tap, that's faucets, that's leaking, and what we are doing in modern medicine is just mopping up the floor instead of actually turning off the tap. So it seems very it seems kind of futile for us to keep putting band-aid on the symptoms instead of addressing the real cause. And we do know now that the cause can be treated using all these measures of lifestyle medicine. So can you tell us, explain, Anjali, how it's being practiced? I mean, now we are starting it here. It's pretty new in India, but how is it being practiced in other parts of the world? A little bit about combined practices, and having collaborative practices with dietitians, with other people who become a part of the team.
Yeah. So the first thing is that we have to see that it is a part of allopathic mainstream medicine. The medicine has actually come a long way. We have done, I mean, in medicine, there have been so much of advancement from, the antimicrobials, the vaccines. We have really, evolved a lot in medicine. Unfortunately, where we have failed at the moment is the non-communicable diseases. And I think that is very rightly you said that it's like you have to close the faucet rather than mop the floor. Maybe mop the floor also if required, but the faucet has to be closed first. And which is what I think, if in all mainstream medicine also, there has to be a lifestyle element added to it. Uh, it could be just a lifestyle clinic, standalone lifestyle clinic, or it could be any specialty also counseling their patients about lifestyle medicine, or how to make the relevant lifestyle modifications. And Well, there is a problem because lifestyle modification, I mean, it takes time. The lifestyle consultation is much more time consuming
Yeah.
than a normal regular consultation. So it could be either you go to a dedicated clinic or you have separate visits, you know, either of these. But in a lifestyle consultation, yes, you said very rightly, there needs to be a nutrition counseling, there needs to be some advice about physical activity.
Right.
If
Exactly.
if there is any sleep issue, then you have to address the sleep issue, the stress part, everything. So it has to be a collaborative approach, a team approach, which
Yeah.
works well.
Yeah. And they do have things like group consults,
Yeah,
where groups of patients like diabetics, groups of diabetics, or groups of, let's say, even polycystic ovaries,
yeah,
etc. When they're, and uh, this adds support to the patient. Patients also find some sort of commonality with other patients. They're able to
yeah,
discuss, they're able to, and that's less time consuming for the physician as well. So that's also a part of lifestyle medicine, isn't
yeah.
it?
See,
Yeah.
being in a group motivates, you
Yeah.
know, uh, the other people, because somebody who's doing better, I mean, yes, it has to be balanced well, but then seeing that somebody can achieve the same target that you are not able to manage, it actually motivates you to to work harder, to be more careful about your diet or something. For instance, in a diabetic, yeah, it will motivate. Yeah, let me be a little more careful about the sugar I take or the diet I eat, so that I can also achieve that target of decreasing my HbA1c or my blood sugar. The
Yeah.
groups work very well. I mean, for most people, I think I would say groups work better than individual.
Good. Yeah, especially I think when if the family environment is not as supportive as it should be, as we see very often,
Yeah,
the patient is supposed to eat a different kind of food, cooked. You have to cook separately, so all those things become very difficult. And I think in that case, when you attend a a setting, and these groups are guided by the physician, so it's led by the
yeah,
physician, or it
yeah,
can be a trained coach. We have health coaches also who can come
yeah,
into the picture. So you have the trained health coach or a physician leading the group, and you have these group consults, and you have people talking to each other, patients talking to each other, asking questions which they may not even have asked if they come into a physician's office.
office, yeah.
Yeah, they pick up the courage to ask a certain question or ask a doubt which they may have thought is silly, but they realize that somebody else has the same doubt. So it works very well.
It
And
works very well.
yeah, and other aspects of lifestyle medicine, which we've talked about, the nutrition, the exercise, stress, as well as counseling
Yeah.
in many times, the motivational counseling. In order to keep the patient or keep the client motivated to continue to exercise. So, some amount of collaboration with, let's say, a dietitian or a nutritionist, collaboration with a fitness person,
The
somebody who's
instructor. Hmm.
expert, somebody who maybe somebody who's certified in yoga, who can actually teach the exercises. If that's incorporated into your own practice, it helps.
Yeah.
Yeah, and yeah,
So the idea is to empower the patient to learn these things and to be independently following it later rather than hand holding the patient forever.
yeah, forever. Yeah, initially there's some amount of hand holding
Yes, there
is
will be. Hmm.
absolutely required.
Yeah.
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 See, one of the things I think is that it is a branch of allopathic medicine. Obviously, it is, and
Yeah.
it pertains to every field of allopathic medicine. So
Absolutely.
whether it is a physician or whether it is an obstetrician, a surgeon, even because post-surgical, post-operative care, it's important to include lifestyle measures. All of that, every aspect of every field of medicine, allopathic medicine, can benefit from lifestyle medicine. And I think one of the reasons, and you'd agree to this, Anjali, when we passed out of MBBS and even our MD, what did we know about diet and exercise?
Oh, nothing. It's been a learning experience. I mean, it's you have to I mean, read so much into detail, and then there is so much to it now. I mean, diet is not about what you eat. It's not about calories. It's not about the macronutrients. It's about every food that you eat is going to switch on some genes. It's going to switch off some genes. There is so much to it, and it's so interesting. And it's how we can use diet more and more effectively for you know actually we can modulate the body's functioning by just changing the diet, and personalized nutrition. I mean, these are all something which is coming up very well recently.
Yeah, yeah. And if we just look at the different pillars of lifestyle medicine as they're called, do you want to just talk about just a little bit about each of the pillars and how they could impact health and disease?
Yeah, so the main pillars, we talk about six pillars. One is nutrition, exercise, sleep, stress, social connectedness, and emotional well-being, and of course, and substance abuse. So
Yeah,
nutrition, of course, we've just been talking, and in fact, nutrition is so much more than the food that we. It's just more than the taste, and it just changes the way your body functions. It
yeah,
you and it also changes the way your gut functions, your gut microbiome functions. You're not going to be eating just for yourself. You have to feed this 10 trillion bacteria and the organisms that are there in your gut.
yeah,
So all the aspects have to be incorporated. Everything has to be thought about, and then the diet should be individualized, and of course there are broad outlines and guidelines that we have to follow. But beyond that, if there is a disease, so much of individualized things can be done.
yeah,
And I think we, like you said, the cause is basically not the hypertension. The cause of hypertension is the increased salt, the increased fat that you are taking.
yeah,
So if you start going into the why did hypertension happen? Why did where did we go wrong? If you start dealing with that, you automatically start dealing with the diseases, with taking care of the diseases. Similarly, for physical activity, I mean, if you're active, it's actually the fourth leading cause of death. Um, because people are not physically active. I don't think there is any country in the world where people are 100% people are follow the adequate guidelines and fun 50 minutes of moderate intensity exercise per week.
in
But
fact, the Indian guidelines just came in, didn't they?
yeah, they did. They
Yeah.
did.
Do you want to just elaborate a little on that?
Uh, Okay. Um, Let me just
Any-
talk about the physical
Sure, sure,
activity, then I'll
sure,
go
please.
back to nutrition.
Yeah,
So just following the guidelines itself increases 3 to 4 years of your lifespan, and the more you increase, I mean, if you go beyond the 150 minutes per week, it increases your lifespan even further. Of course, it's not a uphill graph all the time. There comes a phase when if you do beyond a limit, then it starts harming your body, because there is as much as your muscles and your heart can take. But
yeah.
having said that, I don't think many people reach that level, except for athletes and sports
Yeah,
people.
despite the fact 150 minutes per week is really not very much at all.
Nothing, it's
Think
nothing.
about it, it's just 30 minutes. Yeah, 30
30
minutes a
minutes
day,
5 days a
basically.
week, yeah. You
Yeah,
still
yeah.
have 2 days off.
Yeah, yeah,
Yeah.
yeah. But also, I think one must stress here that 150 minutes a week is only exercise, and that doesn't mean that you can be sedentary through the rest of the day.
You can't sit for the rest 23.5 hours of the day. No,
Because
that's not there. Yeah, yeah,
sitting itself is an independent risk factor, as they found out for
yes,
various other,
yeah,
problems. So,
yeah.
yeah, yeah, that's about physical activity.
Physical activity. So I think I'll leave the rest to you. I'll just mention about the
But
nutrition guidelines
yeah,
that you were mentioning. So recently, only the ICMR and National Institute of Nutrition have come up with the Indian, a lot of Indian data, and it's amazing. One of course, it's amazing how much of diversity is there in India. So you have one region to another region, the statistics is absolutely different. there is so much of difference in the rural and the urban areas. I mean, I'm sure everywhere in the world there the statistics differ in rural and urban areas, but it, I don't think any other country could have as much disparity between the two, and then there are our social beliefs, our regional differences, and it's so much so that like in the north, the amount of the if you go by the macronutrient intake, the amount of fat that is consumed is maximum in the north,
Mm.
and the
Mm.
central
And
India is much better. Yeah,
I see. Mm.
is higher than normal. And if you look at, of course, all over India, the vegetable and fruit intake is not up to the mark,
Yeah,
and it's
considering that
it's
India
hard.
is supposed to
See,
be vegetarian. I
yes,
mean, not all of India, but yeah.
yeah. So 8% of your calories should be coming from vegetables and fruits, and there is no region in India where the targets are met. It's as low as 2% in some areas.
Mm.
And similarly, the generally carbohydrate intake in India is much higher than other countries, many other
Yeah,
countries, of
yeah,
course.
and refined carbohydrates, isn't it? The
Sorry,
refined carbohydrates.
refined is more, and
Yeah,
but again, it is again there is so much of regional differences. But yes, in the south, there is more of carbohydrate. Carbohydrate intake is higher. The if you look at the nuts and seeds, again, I don't. There is no state in India which is where the intake is adequate. And of course, fat intake is more or less higher in north, south. I think, yeah, and northeast also. In fact, northeast has the highest hypertension rates.
I see. Okay.
It's surprising. I was surprised to read that, but northeast and eastern states have the
Mm.
highest hypertension rates. The
Mm.
diabetes rates are highest in the south, compare, and next, of course, north.
Mm.
Somehow central India does much better. It
Okay.
has it has
Okay.
done much better according to the statistics.
Okay.
Whatever the
Okay.
reasons, I'm not aware of it. But so these are a lot of differences. But most important thing is that we have we are born with a disadvantage. Genetically, we are prone to central obesity. The
Mm.
the percentage of central obesity is phenomenal in India. 50% plus people have central obesity in India. And
Yeah.
of course, the obesity rates are much higher, is about 4 times higher, so around 12% in the urban areas. And the younger populations are more and more prone to
Prone to die. Yeah. Yeah.
obesity. This is going to translate into higher incidence of hypertension, diabetes. We are already seeing teenagers with pre-diabetes, diabetes, fatty liver. Their blood
Yeah.
pressures are higher than the pre-hypertension. A lot of teenagers have pre-hypertension, but these things are, if we don't take care of them now, what are we looking at in the future? Nation where most of the young people will be sick, and what will be the productivity, what will be the quality of life to look
Yeah.
at it in long terms. So I think that the only solution is to just use lifestyle medicine to from at whenever possible
Yeah.
to be able to deal with this. It's like a pandemic. Actually, we talk of COVID as pandemic, but I think this is equally important as
Yeah.
a pandemic.
Yeah. And probably when patients, you see, there has been research which shows that the doctors who all practice lifestyle medicine are the ones who are likely to counsel patients, more likely to
Yes,
counsel patients, isn't it? It's like a doctor who's a smoker is very unlikely to be telling a
unlikely to tell.
patient to
Yeah,
stop smoking. So, in fact, this is also one of the aspects of lifestyle medicine. What we are taught that the physician's role is not just to teach and to propagate it, but also to practice it himself. isn't it? All these aspects, we are supposed to inculcate it into our lives before we can actually start talking about it, because it's only then that you can actually speak with conviction, which is what I truly believe also. Because
Yeah.
if you don't follow it, it's very unlikely you're going to be convincing enough to your patients to be able to tell them that not just for a month or 2 months, but as a lifestyle, as a
You have to
permanent
follow it.
solution,
You
as
need
a
to
permanent
follow it. Yeah.
solution. Yeah,
Yeah.
yeah,
So it's similar to, if you tell a child to do something, if a parent is telling a child to do something but not
yeah,
doing it themselves,
yeah.
but there's no way it's going to happen.
Follow it.
And
Yeah, yeah.
similarly, an obese physician, I mean, they cannot be convincingly guide the patients, no, you need to lose weight. So
Absolutely.
I think we as physicians have this commitment, to ourselves and to our patients, to
Mhm.
practice what we preach. I mean, first thing is to first do it ourselves, and then of course help others to do it.
Absolutely. Yeah. And what are the other, just briefly, what are the other pillars, Anjali?
I thought you were going to talk about it, Sheila.
Yeah, we can touch upon. Yeah, you have sleep. Sleep is a very, very important
Yeah.
aspect, and we know that. Well, the recommendation is 7 to 8 hours. Honestly, I really don't know how many people are getting 7 to 8 hours, especially physicians. And then, of course, you have the computer and all the gadgets which keep us awake. In fact, today I did a session with somebody who had sleep issues, and the thing is, there are some very simple measures that one takes in order to be able to, what is called a sleep hygiene, in order to be able to get to bed at a particular time and set that whole routine. But very often, and it's easy for us to tell patients or clients, these are the things that you're supposed to do. But what's very concerning is that many of them lead lives which just don't encourage this kind of a routine. They work late. Many of them work with where their clients are across the globe, so therefore they are they have meetings late into the night or very early in the morning. And then of course you have the shift workers, and you have people who you have the younger generation who are online all the time. So it's really quite frightening when you think about the kind of disruption that this blue light from the screens, and the very, very high intensity light from the screen is having on our brains, starting from such a young age. You have like 3 4 year old kids on their iPads. You know how efficient they are on their iPads or on the phones.
Absolutely.
So that's really, really concerning. And I think we underestimate the importance of sleep. We underestimate that sleep is the time that your brain is able to flush out all the toxins through the lymphatic system. It doesn't happen during the day, and unless you have good quality sleep, even if it's not 8 long hours, even 6 hours of good quality sleep is far more important. And we know, isn't it, that even one night of lack of sleep, it disrupts the blood sugar levels just the following day, and
Yeah.
you're literally
It's
pre-diabetic,
yeah.
literally pre-diabetic the next day. When I read things like this, I wonder, I think to myself, as an obstetrician, I have spent a very large part of my life sleep deprived.
Mm.
And I really wonder what kind of repercussions that's going to have later on, because when you are woken up in the middle of the night and you enter a brightly lit labor room, and then there is high energy and it is high stress and it's drama all the time for an OBGYN, and then you come back and you take a good half hour, 45 minutes to get back to bed. So you've lost essentially about 2 hours a night, even if it's just one delivery. And the other very interesting thing that I noticed about myself is that even if I've had my dinner, let's say by 6 7 o'clock, and if I'm called into the hospital, I used to come back from the delivery or from the case and want to head straight for the fridge. It's not that I was hungry, it's just that your body is kind of confused about fatigue versus lack of sleep versus hunger, and you just want to soothe it, and the easiest way you see to soothe it is food. So when I started recognizing this pattern is when I said, I think I'll need to stop with just a glass of water or maybe a cup of chamomile tea or something like that. So unless you are, this is where the mindfulness comes in, and this is where you have to also teach, we teach patients to do this as well, where you're just mindful about um, the kind of habits that you form, and you just go through the motions without really thinking about what it's doing to you and how it's affecting you and so on and so forth. So sleep, absolutely important, and we do a lot of work with patients who don't have enough sleep. We counsel them about sleep and of course inquire, how many of us as physicians actually ask a patient, how many hours do you sleep? you
So
know
it's very
we don't
important.
ask that question. Yeah.
Yeah, and actually, I think the worst. I mean, of course, anybody is affected by poor sleep, but the worst affected are the teenagers. See,
Yeah.
they require about minimum 9 hours of sleep, and I don't know how many, even with 1% of teenagers are having that sleep,
Yeah.
let alone following the what we say the chronobiology of
Yes.
sleeping at the right time and getting up at the right time. But
Yes.
in fact, interestingly, New York changed the school timings, and they asked children to come in late because to the schools to start late so that children could have enough sleep, and it affects their the way their brain is growing. It's such a time where their brain is evolving. So the various changes are happening in the brain, and they're learning. They're evolving as a personality, as so many changes are happening in the brain, and just because they are not sleeping enough, they are
Yeah.
worse off for it.
You said in New York they're changing the times, did you say?
They had changed the timings.
I see.
They had
Yeah.
made this, so they asked the schools to start a little later so that children
Yeah.
could
Yeah.
get
Yeah.
enough sleep. Yeah.
Yeah, yeah. And in cities here in India, a child travels about an hour or an hour and a half in the school bus to get to school, which means she has to leave school at around 7, which means she has to get up by 5:36. It's really quite I think it's a social problem, not just an individual problem again, which means there's very little one can do to actually help in terms of changing the timing of the school. But what can be done is, of course, talk to parents and the children about getting to bed earlier and all of those things. So yeah, so sleep is extremely critical. And then
And
we have, of course, the next pillar being stress. And I think
big
stress is
one.
it's a big one. Yes, it's a big one. And it's a precursor to almost every kind of disease, illness, autoimmunity, even been implicated in cancers,
Yeah,
isn't it? So
50% of cancers, they say there is an element of stress
yeah,
somewhere.
yes, yeah, yeah. The very interesting study from Australia, which looked at the recurrences of breast cancer, and they found that those women who were stressed, as compared to the women who was those women who were stressed but had no social support, compared to the women who were stressed but had the social support, the incidence of recurrence was higher in the former. So it was
Yes,
not the stress per se, because obviously every individual has stress, but I think the stress not being mitigated using social support could be the real trigger.
yeah. So
Not
there is
having
this.
social support, not
So
having social support. Yeah.
yeah. So even interestingly, even mothers who are stressed during
Mm.
pregnancy, there is a effect on the brain of the children.
Children, yes, yes,
And because of the high cortisol levels, the way their brains are growing and the way their bodies are reacting, even the fetuses get affected by the stress of mothers.
yeah, yeah. And in terms of stress, the something called mindfulness-based stress reduction, MBSR, is something that we are, is part of lifestyle medicine. Mindfulness meditation is part of lifestyle medicine. So these are the aspects that we are taught as part of the curriculum, which we can actually teach patients, and of course, which we should be practicing ourselves. I'm sure it will be of great benefit to all of us who are stressed. Like I said, I don't think stress per se is the problem. It's how we deal with the stress and the whole thought process. So, again, in that respect, cognitive behavioral therapy, that's where that comes in. And that's also a part, I wouldn't say a part of lifestyle medicine, but definitely is encouraged because so having a CBT practitioner, having a psychologist on your team when you're doing lifestyle medicine would help because managing stress is basically about changing the pattern of thoughts, your thought process, and the flow of thoughts. So, aiding that would be somebody who knows how to deal with the CBT, how to teach CBT to patients. So that is one of the pillars of lifestyle medicine. And then, of course, you have substance abuse, and we all know about tobacco. I mean, I think that's been done and dusted. There's no doubt that increased incidence of cancer, but again, there is the link between cancer and the stress in even
Yeah.
in smokers, isn't it? Because it's not every smoker that gets cancer. The combination of a smoker with high stress levels, which have not been worked through, in fact, studies saying anger that has not been expressed, these have been implicated as some of the causes for the genes that are responsible for the cancer to be triggered. Because we all have genes for cancer, and they just need to be triggered in order for the cancer to actually present itself. So, behaviors like suppressing anger, suppressing emotion, being highly stressed, not being able to manage stress, all these things can trigger these genes that cause the cancers to evolve and spread.
And the
Um,
surprise part is the social connectedness, which
yes,
I think we've learned over the ages. I mean, over a lot of time. In fact, the Harvard study has been on for about 75 years on the
yes,
across three generations, where they
yes,
found that the most important cause for longevity is social connectedness. It's not nutrition, it's not physical activity. So
yeah,
loneliness is a very, very big thing. And
yeah,
I think we during the pandemic we are realizing, I think there's a lot of, because you're not able to connect socially so well, it's affecting mental health for a lot of people. Of course,
yes,
virtual connections are there, thankfully. At least there is some way we can connect with our near and dear ones, but
yes,
still the impact of isolation is very big,
it's very
and
big.
it's really leading to a lot of mental health issues during the pandemic.
Yes, yes. Yeah, so that would be the last pillar, the social
Yeah.
connectedness, right? So sleep, stress, relationships, exercise, nutrition, and substance abuse. And
Yeah.
all of these are addressed extensively. And then, of course, we have environmental factors, etc., isn't it? That
Yeah.
that we discuss with the patients. So, so, so Anjali, would you say that this is that lifestyle medicine would be a very, very, very important part of allopathic medicine going forward?
Yes, Sheila. The see, if you look at it, I mean, if I talk about the Indian perspective, see, we have so much of so many factors. Our population is phenomenal. Our genetic disadvantage is there. We are, our diversity means there's a lot more things to be figured out area wise, and and of course our health system is also not as robust as many other countries. the rural areas, there's quite a lot of lack of the health infrastructure, but that's where we have to come in as lifestyle medicine physicians, because like you said, mopping the floor is not sufficient. So we have to get to the root cause of the problem and
Yes.
help people manage that. And it's
Yes.
not just about being disease free. It's not about preventing diabetes or hypertension. It's about better quality of life. But thankfully, there is a lot of research now happening. Premier institutes like AIMS, ICMR, there is a lot of research happening, and I think
Yes.
and the government's initiative of wellness centers is
Yes.
somewhere where lifestyle medicine can physicians can be of great value, and we can also do things virtually. Thankfully, that's another good thing, that lifestyle medicine can be done virtually very well. So
Yes.
we could just engage, lifestyle medicine physicians into these centers and make sure. I think it would be, in fact, an interesting, data to follow, that which which wellness center has managed to decrease the diseases in disease incident by incidence by how much area
Yes.
wise. It would be
Definitely.
really interesting, to have the statistics one day.
Yes.
So
And,
let's hope that
yeah,
it's going to be
yes.
happening soon.
No, I'm sure it will, because I think there are a couple of questions which we'll just get to. I'm sure it will, because you know what I'm finding, Anjali, is that earlier it was people, most of the people who, I mean, I do a fitness practice as well, and most people who came to me came saying the main objective was weight loss. But now people are getting more and more conscious about just about health, not just weight,
Yeah,
and they really understand that just losing weight alone by any means, unhealthy means included, these random diets and even bariatric surgery, although there are very specific indications for it, they are aware that the lifestyle habits are equally important. Just performing the surgery and losing the weight, although that does improve us metabolically, there is a metabolic improvement, it's not enough. We do need to practice healthy lifestyle habits. And that's something that I think more and more people are beginning to understand. So there's a
yes,
quest which is good for us, because I think it's going to make things easier. I find even rural women are very interested in diet. They want to know what kind
what
of
to eat.
greens to use, yes, what to eat, and can I use this kind of oil? Is the red rice better than the white rice? There's so many interesting questions that they ask us. So I think the future is good for India. We are ready for it, and Indians are very bright, so we all will get on to the right track, is what I
Yeah.
hope.
See,
There's
we have a sorry, we have a very good, like knowledge. I mean, our ancestors were very
absolutely,
knowledgeable about so many things,
yeah,
and it's just that we need to kind of just pick up all the threads and kind of get everything together. And
again,
like yoga is something that started from India, and now the whole world is after, then. And we know how pranayam and the breathing exercises, they're just not just breathing exercises, exercising your lungs. They're basically having an impact on your autonomic nervous system.
yeah,
So
yes,
there is so much to it, and thankfully we have a wealth of knowledge. We just need to put everything together, and we'll
yes.
be there.
Yeah. There was a question. So Jayashree Vivek, thank you for joining, Jayashree. She says, I don't know how to tell my teenage son to sleep by 10:30. So you have a son, Anjali. Maybe you can advise her on this.
See, it's a very big challenge, to because I think the day starts at night for the teenagers and adolescents. But I think the first thing is to set the example yourself. I mean, if you're sleeping at 12 and if you're asking your teenage son to sleep at 10, it's not going to work. And I think it's not just going to happen overnight. It's just going to be trying to engage them and trying to explain to them, and gradually just make half an hour changes. So you cannot change your sleeping schedule overnight, because it's all about the hormonal balances that happen, or your melatonin being released, your exposure to light. There is so many things. So it's just better to address one by one and explain to them that what they need to do in the night, they can do it in the day also. I mean, if you start telling them no blue light in the night, but no blue light in the day, well, it's not. They are not going to take it nicely. So it's a very big shift, but yes, it needs to be done, because you don't want them to be on medication 10 years later on diabetes, or on having high blood pressure, or your daughters to have PCOS soon. So
Yeah.
all these things are important, but yes, you have to address them one by one.
And Apavu Dandapani asks, any tips on reducing light exposure on screens? Well, there are um, blue light, what is it called?
Filters,
Yeah,
filters.
filters, glasses, eyeglasses that have the filter for the blue light. I don't know where it's available, whether it's available in any eye store or not, but I know there are filters for blue light, so perhaps you can try that. And
And the screens are also can also be set for changing. There you can many
dim
of
light,
these things. I
dim
think
light. Yeah.
many. I think the Macintosh, Apple products do have that that you can set that after a certain amount, a certain time, the blue light gets less. In fact, NASA has all their screens set after evening. Their
Mhm.
screens go into a different mode. Blue light
I see.
emission decreases.
I see. Okay. Yeah, I guess if NASA is doing it, we all should be doing
We
it.
all should do it. Yes, definitely.
Yeah. So if there are any questions from even the people in the Zoom, if there are any questions, we'll be happy to answer it. uh, yeah. Blue filter coating is available, he says. Please check with the ophthalmologist. Okay.
Yeah.
Okay. So it is available with an ophthalmologist. So the blue filter, is it? Do you stick it on the glasses or do you put it on the screen of the computer? Dr. Sivakumar, who's an ophthalmologist, is answering this question. He says a blue filter coating is available. Please check with the ophthalmologist or the optician. So yeah. So that's lifestyle medicine, and we hope that the Indian Society of Lifestyle Medicine, which is fairly new, started about 2 years ago, 2.5 years ago, and we've just taken over. Anjali as the secretary and myself as the president. We do hope that we can propagate lifestyle medicine not just to the lay people but also to physicians, and we hope more and more physicians can come on board and help us to propagate lifestyle medicine, which is truly the need of the hour. And although it is like Anjali said, the whole consult becomes time consuming, but there are ways in which we can work around these things. And when we do group practices, etc., and restricting, the lifestyle consults to a certain time of the day. And now with virtual, so much is possible. So we really do hope that this happens. And
Dr. Sivakumar is asking a
yes,
question.
yes, Dr. Shivkumar, please join ISLM.
Yeah.
Please join. Yes, we would love you to join. I will send you the link. I will send you the registration details. You can join ISLM, which is a non-profit organization in India, and we will help you if at all you do want to sit for the exam. We will help you through it, help you sit for it or prepare for it. You don't necessarily have to sit for the exam right away. You can just start with practices with all these webinars, etc., that we propose to have. And of course, if you sign up with older organizations like your American College of Lifestyle Medicine, there's a lot of information there as well. So
Yeah.
yes, we will send you the information. Thank you very much.
Yeah.
Good. I'm
Oh, he's
practicing what it is.
practicing. Yeah,
Yes. Excellent. I'm,
that's what we are looking at.
yes.
Thank
Yes.
you so much for already being on board.
Yeah. So we will wind up.
Yeah.
My wife has benefited from Dr. Sheila's advice. Oh, fantastic. Who is this? In fact, I see. Thank you. I'm so glad she followed my advice. Thank you so much, Apavu. Thank you. Nalini Apaji says very, very informative. Preeti says thank you for the informative session. Kapita says thank you for the wonderful session. So Anjali, thank you so much. And it was such a pleasure having you. And I will be meeting you again very soon on one of our committee meetings. But till then, thank you so much for joining. And I'm sure the viewers also benefited. Thank you again.
It's a pleasure to be here, to be with you. And also, of course, it's always a pleasure to talk about lifestyle medicine.
Yes, yes.
It's
Thank you all. Yeah, thank you all.
okay.
And
Bye bye, everybody.
bye
Have
bye.
a,
Bye.
yeah, have a great weekend. Go for a
Yes.
walk, eat a nice salad, and remember lifestyle modification.
Yes. Thank you. Bye bye.
Okay,
Bye.
bye bye. Bye.